What recommended starting dose would be to help with sleep. She has a lot of patients who can fall asleep, but they have trouble staying asleep and they wake up around 2 and then they can't fall asleep. Do you use it just at a certain amount of time? I guess for this situation, it depends on the patient. Some patients, I like to ask patients if they're sensitive to medication kind of right off the bat, because some of them can maybe start at 1.5, and some of them who tell you like, I'm very sensitive, but everything affects me, then I obviously start those patients way lower, like 0.1, 0.5, and then I kind of taper from there. So I would say it really depends on each patient that you're treating. Some of them don't have any symptoms right away, and some of them have a ton of symptoms you start LDN. So it's very patient dependent. Generically, I would probably start them at a 1 or a 1.5 milligrams, depending on the patient, if they're a normal patient. Does it help with staying asleep? Yes, like I said earlier in the lecture, I think sleep is interesting because a lot of times there's underlying disease states there going on, and if you can control those, then the patient ends up sleeping better in the long run.